Today we are at Tshwane District Hospital here in the city of Tshwane. It's one of the hospitals that we are investing in to strengthen the district health system. We know that with the NHI as well, the district health system is very important. Specifically today we are here to open officially the renovated wards that looks after maternal and child health. This is a very important area of our work, and I'm very happy. I'm actually excited. The work is of good quality. The patient flow is also much more efficient. We even have a new bridge that links the labor ward and the neonatal ward to ensure that there is that efficient movement between the two wards as well. I've spoken to a number of health workers, and they are very excited to work in an enabling environment. Beautiful, the colors are lovely in the pediatric ward as well. The colors are coming as well. I also went to the prenatal section of the maternity just before the mothers go to maternity, and they are very excited. This is one of the projects that were done jointly with the Department of Infrastructure Development, and I want to thank DID for being true to their commitment that they will give us quality infrastructure on time, every time, and that there will also not be delays, because delays also cost additional funds, which we cannot afford to have. So I really appreciate the support of MEC Mamabulo and his unit. I'm also satisfied that the infrastructure unit of DID and the facility management unit in this hospital are working well. It has helped us to delegate responsibilities to CEO, and I'm very excited. So is the staff that Dr. Sue has been very passionate to ensure that these services are there for our people. Our priorities are, if I can summarize, in 5 areas. Firstly, to ensure patient safety, particularly around maternal and child health, as well as in the trauma units, but throughout the service. The second issue is quality of care. Many people don't really appreciate what quality of care is. Quality of care also includes attitudes of staff. I have also asked patients to share with me how their experience was, and many are actually applauding the attitude of nurses. You'd recall that there was an incident when one patient left here and delivered on her way to South Rand Hospital. I've satisfied myself that her anxiety was more because of staff attitude when she was told that she's likely to have a cesarean section, and she got scared and left. Maybe the way it was said as well. So the environment here is coming, and the doctors are there also to ensure quality, and there are additional pediatric services that will be provided here, including the neonatal ward has been upgraded to ensure that there is quality care, so quality medical care in the clinical governance area. The third issue that is important for us is what we've come here, infrastructure and modernization. So we have seen a lot of modern equipment in the resuscitation areas, and there is also a link between the maternity and the theater, so for ease of access, and also from theater back to the ward for mothers that have done cesarean section. So modernization also includes issues of security. There are the security in the ward, remotely controlled with video cams to be able to see the whole of the ward and to control the door as well. So this is safety also for patients and staff. But the one thing that I think we must do is also to improve electronic patient record system. And Dr. Sue has assured me that it is on track. The fourth issue that I suggested is important is around partnerships, especially governance. And I'm happy that I'm here with the acting chairperson of the hospital board. Other members have been here, and indeed strengthening the hospital board will help us be responsive to the community. But our strengthening of the hospital board would also mean that the hospital boards must do more to monitor patient satisfaction, to monitor the finances of the hospital, to monitor projects like these. And I'm happy that the team is well balanced and it has the competency to do so. Last but not least, our other partners outside the health system. I want to make a call that the media must feel free to communicate with CEOs of our hospitals, and that the CEOs of our hospitals must also cooperate with the media, because in many cases the misunderstandings that arise are not dealt with because there is no communication. So communication is absolutely important. We want to take back our health system to where it belongs, to the public, and the media is an important partner in that regard. There were also other funders here. For instance, APSA has also made donations to make today's event a success. We would like the partners from corporate sector to help us strengthen the work of the governance bodies, the clinic committees and the hospital boards. But I'm really excited and have received very positive feedback, and with the number of CEOs invited here, I think many of them are also inspired, and we're turning the leaf in terms of the infrastructure, the feel of our health facilities. And many patients tells me it's better than many private hospitals. Public sector must be better than private sector.